Joining us now from Beirut is Krystel Moussally. She's an epidemiologist for Doctors Without Borders in the Middle East and North Africa. Thank you so much for being with us on the program. In that package that we just watched there, it detailed the dire conditions that people have been forced to endure. And areas like that have become hotspots, as you know, for diseases, ones that we're now learning antibiotics are unable to cure. How big of a threat is this becoming?
Obviously we're talking in Gaza in the middle of this genocide at the community level. There is a lot of all the conditions that needs to be there for the spread and the transmission of infections, and especially again infection that as you mentioned are hard to treat with the common antibiotic that we have. We are witnessing a total blockade and siege on all the supplies coming in. This obviously includes antibiotics as well. So where antibiotics are becoming a luxury, so we're not able to appropriately treat infections, which again leads to resistance, to the emergence of resistance. We talk at the level of the community, but also at the level of the hospitals. We're talking about conflict-affected wounds that are left open. So we're talking about infection prevention and control measures that are almost inexistent. So we don't have enough water, we don't have safe water, so even basic hygiene measures are not there. So this leads obviously again to the emergence of resistance infections. So we're talking about infections that are more difficult to treat, that are more complex basically, that can also lead to more killings and to permanent disability, to amputations, to a very high mental health toll, socioeconomic, you name it. So it's a disastrous picture really that we're seeing, especially with the fact that no medications or very little medication is being allowed into Gaza today.
Right, not to mention the weakened immune system that Palestinians currently have, given that they're not able to have access to the necessary aid, pairing that with not getting the proper treatment. Medically speaking, doctor, what happens to the human body in this scenario?
I mean, you mentioned malnutrition. So today, again, we're witnessing a deliberate and institutionalized starvation, right, that is happening. So malnutrition weakened the immunity. So it is, again, people become highly susceptible to getting infections. And again, those infections are not being treated, or are not being treated appropriately, or we don't have what it takes basically to treat them. So this leads to more killings, again, indirect killings from the war. So we're not talking anymore about killings from bombings, and we're not only talking about killings from the deprivation of basic needs for people, but also from all what is being deliberately enforced basically on the body. The body needs to fight, but it doesn't have what it takes to fight even the most simple infections like diarrhea, for example. In our primary healthcare settings today, or in the MSF-supported facilities, around 20% of almost 1 million consultations that were conducted in the first 2 quarters of this year are related to water and lack of hygiene. So again, skin infections and acute diarrhea. So even, again, simple infections like this, the body is not able to fight anymore.
All right, epidemiologist with Doctors Without Borders, Krystel Moussally, thank you so much for being with us here on the NewsHour.
Thank you.